Hello everyone. Today we're going to talk about artificial joint. Are you chronically suffering from the osteoarthritis and painkillers are no longer useful? Did one of your relatives and friends suffer from an injury in one of their joints and needed to replace his or her joint with an artificial joint? Well, joint replacement is considered as a treatment when severe joint pain or dysfunction is not alleviated by less invasive treatments. After watching this video, you'll be able to learn everything related to artificial joints, their types, how it is inserted, and the quality of life after joint replacement, in addition to the expected complications. Our role today is to answer most of your questions regarding artificial joint. Today we have Dr. Seo, who is a leading doctor at Yonsei Sarang Hospital. He's going to discuss with us everything about artificial joint from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases.
So what is exactly a knee joint, and what are the features of its structure?
The knee joint is one of the largest joints in the human body, and there are the weight-bearing joints of the lower extremities, the hip joint, the knee, and the ankle, and the disease most commonly occurs in the knee. That's probably due to the nature of the structure. The hip and ankle joints are very stable in their structure. Therefore, there is relatively little possibility of injury, and the structure itself is well equipped to protect cartilage. But the knee joint doesn't just move like a door or a hinge. Everyone thinks that, but actually, the knee has a very complicated rotation, and the shape of the skeleton itself is not stable like other joints. So in order to keep the knee joint intact, not only the bones and cartilage, but also the cruciate ligament, collateral ligament, and various ligaments, cartilage plates, and various tissues must be intact to maintain a normal knee. In fact, even if one of them breaks down, a problem occurs. So it is the biggest characteristic of the knee joint that it is complicated and easy to damage.
So we often hear that athletes and people or older people suffer a lot from knee joint. Why is it so?
This is probably because of characteristics of the knee joint that I just mentioned. Athletes get hurt easily because they work out so vigorously. Even if one of the various structures of the knee has a problem, it will start to break down altogether. However, since athletes are often injured, of course, there is a high possibility that they will have problems with their knees. And those who are obese, the size of the knee joint is fixed as it won't grow any bigger when you become an adult. The strength and thickness of the cartilage are also fixed. However, if you gain weight, you will put more weight on the knee, whether 50 kilograms or 90 kilograms. Your knee has to support that. So when you're over the appropriate weight, as you do the same type of activity, running, exercising, climbing stairs, you'll be working for that extra weight accordingly. But in fact, it's not just about working extra for the weight. For example, just because I've gained 10% of weight, it doesn't mean that when I stand still, I'm putting 10% more weight on my knees. Each time you walk, you usually carry twice as much weight as you have gained. And when you sprint or jump, you carry up to 10 times more weight than your maximum weight gain. So 5 kilograms of weight doesn't just add 5 kilograms more to your knees. In fact, it can add up to 50 kilograms in an instant. So when your weight exceeds the normal range, of course, possibility of cartilage damage increases. And why are older people and the elderly so prone to damage? Like other joints, everyone goes through the process of aging and degenerative changes. But as I said, the knee joint is a particularly important joint. And although it is a very large joint, its structure itself has some instability. So it's a pity for older people. But as it's natural for anyone to grow older, the ligaments and cartilage get weaker. So there's a lot of potential for problems. But that's not all. The thing is that even if there is some kind of damage or aging or other problems, in fact, there is a higher chance of progressing to arthritis from there.
So what medical examinations are done to see if the knee joint is normal or not?
The methods of diagnosing the condition of the knee are basically the process of receiving medical treatment by identifying the medical history, the patient's gender, age, and occupation. And we also figure out what their hobbies are and what exercise or sport they do. Because the pattern of problems also changes depending on the lifestyle, we would be able to identify such issues by examination through the eyes of the doctor, direct examination, and so on. However, there is a basic examination, and in addition, X-ray to make an accurate diagnosis is a basic examination. But X-rays are like shadows in a way. Of course, there's a lot of information, but can't cover everything. Because as those of you who have taken one will know, if you take the knee joint as an example, you can see 2 or 3 bones, and there's an empty space. But the empty space is actually not empty. It's actually filled with cartilage and cartilage plates and ligaments. However, since it is not exactly visible on X-rays, there are cases where additional examination is required. And in that case, tomography, MRI, ultrasound, or other imaging tests to obtain more detailed information are additionally performed. And that's just looking at the picture. And since knee diseases do not simply divide the cartilage into worn out or not worn out, there are cases where they are actually related to systemic diseases throughout the body. In many cases, a blood test or a sample of joint fluid can also help with the diagnosis.
When is conservative knee joint treatment used?
Of course, there are times when a patient needs surgery right away. The patient has a broken leg and is unable to walk because of a serious injury. But if the symptom period has not been long, or they have been recently injured, and still walk and carry on with daily life to a certain extent, then first of all, conservative treatment is performed. Most diseases require conservative treatments first, whether it's taking medication, undergoing physical therapy, changing lifestyles, or exercising. However, even after adequate conservative treatment, if there is no improvement or if it worsens after 3 months or 6 months, then you may be able to adapt to surgery.
At what stage can we say that the surgery is needed?
There are many types of diseases, and in the case of an injury, there will be an indication for surgery when it is very seriously injured. But speaking of degenerative arthritis, the disease is classified and staged accordingly to various criteria. But the most common is Kellgren-Lawrence grade, which is the stage of progression on the X-ray. Very specific surgery, artificial joint, joint replacement, etc., are usually done when more than 50% of the original amount of cartilage is lost. That is, when the 3rd and 4th stages are reached. There is a high possibility of adoption to the surgery.
After the surgery, how do the patient lead a normal lifestyle?
It seems to depend on the type of surgery. Artificial joints are not the only types of surgery. Among patients with an immediate stage or higher, stage 3 or 4, there are cases where conservative treatment is not sufficient and the surgery is required. Depending on the severity, the age of the patient will be different. But there are cases where it is lightly treated with an arthroscopy and endoscope, and there are cases where we use osteotomy to change the shape of the leg altogether. Again, the most common treatment is an artificial joint, which is performed by over 100,000 people a year in Korea, and over 1 million a year in the United States. Taking this as an example, it actually doesn't take that long to get back to your daily life. It also varies slightly by age group, but the most common age group is the late 60s or mid-70s, and 2 or 3 months is actually enough for walking and simple daily living. And when you get very well, you can usually go back to hiking or leisure activities at the 6-month mark. That's just the case with artificial joints. But there are other treatments. However, depending on the type of treatment, some heal faster than an artificial joint, and some actually take a little longer.
What is the difference between a total knee replacement and a partial knee replacement?
Total knee literally replaces the entire knee. Usually when deciding on treatment, treatment is divided into 3 areas: the inside, outside, and front of the knee. To apply a partial knee, either the inner side should be bad or the outer side. One or the other. For example, the inside is most commonly the bad one. As if we say that almost terminal. Partial knee is only applicable if front and the outside is normal, or at least close to normal. This is total knee arthroplasty, when the knee is very badly injured or deformed, or when the entire knee needs to be replaced. This type of total joint arthroplasty is performed. For selected patients, partial knee replacement is also possible if the bones are strong. Only one side of the knee is bad, and the leg is not severely deformed. In fact, it's basically the same treatment. They look similar, don't they? The material is also almost the same. The upper one and the lower one are each metal. Usually the lower part is titanium alloy, and the upper part is often an alloy called cobalt chromium. It varies from company to company, but it usually is the same. And can you see the white part that's on both of them? This is artificial cartilage that plays the role of cartilage, a plastic called polyethylene. The material is almost the same, but the difference is age and condition. In fact, the artificial joint can be applied to almost any type of deformity or problem, but the number of patients who can actually apply the partial knee is very limited. There are two, usually from the 50s to early 60s, when relatively young, strong bones but severely damaged one side of the knee, but not severely deformed. Either that, or since the operation is small and safe, it is applied to people in their 80s or older when they are very old, in cases when the knee hurts so much that they need surgery. Although they are quite similar, the biggest difference is that the treatment is small, so the advantage is that it heals very quickly. The treatment is almost 1 to 3 times different. If this is 1, this is about 3, big surgery. The smaller the surgery, the less painful it would be, right? So the recovery is faster. That's why I said it would only take 2 or 3 months to return to the daily life when the artificial joint was used as a whole. In fact, in the case of a partial knee, it takes a month to return to daily life. And it depends on the type of work and occupation. But the advantage is that it heals quickly enough that many people are already working within a month.
So, Dr. Seo, are there any cases where the human body rejects the artificial knee joint?
Rejection is rare. Patients may be allergic and may see hives on their skin or feel slightly itchy in their knees. Even though the knee has improved enough to be healed by artificial arthroplasty, there are cases where the patients are allergic to metals for no apparent reason. So there are such cases. In a way, it's a really troublesome case, but it's actually difficult to sort it out before surgery. And even if it is possible to detect, there are many cases where there is no other way. So even when patients know that they are allergic, they would still choose to do it regardless. But among some products these days, there are implants that reduce allergic reactions by coating the metal surface with ceramic.
So are there any contraindications or complications of knee joint replacement?
Actually, this is not a small treatment. And as you know, it's not the kind of treatment you do to very young people. So 50s if young. And in the case of artificial joints, the average is early to mid-70s. Since it's the older age group, this is not a small operation, so various complications may follow. It's not very likely, though. So expect for cardiovascular complications that can be followed by any surgery. Complication that can occur with high probability of replacement alone is inflammation, meaning infections can occur. The reason is that even if there is a material that is selected most suitably for the human body, it is still metal. It is kind of a foreign material. It shouldn't be done as it's iron. So antibiotics are also used to prevent inflammation. But compared to the types of surgeries that do not contain metal, the risk of inflammation is slightly higher. But the probability is not very high. It's usually 0.2%, so about 1 in 500 cases. It's the most common of the complications that can occur, so it is a big deal if it does happen. But it is fixable. There are ways to treat it, because it also happens with a certain probability. So if such a complication occurs, we can fix it according to the protocol.
Last question. So for how many years this artificial knee joint has been used?
Almost all patients who have decided to undergo surgery are curious about this. It's because the average life expectancy is very long these days, especially in Korea. Nowadays, living up to 90 is not such an unusual occurrence. We are opening into an era in which living 100 years is not really that special. They're saying it's the era of the 100-year-olds. In the old days, people used to think, I won't make it to 80. But it's not like that these days. Now, a lot of people say, I won't be gone by 80, and 10 years is not enough time. Of course, there may be people that think radically and say, I'll get it again if it breaks after I use it for 10 good years. But usually, that's not the case. It would be good to get it once and have it forever, right? And everyone seems to have a misunderstanding about this lifespan. If the doctor says 20 or 30 years, it doesn't mean that it should get damaged enough to be in the state for surgery in 20 years' time. If so, we'd be talking about survival rate. Even after 10 years, more than 90%. And even after 20 years, the latest artificial joints are almost 90% intact. So that's why I say it would last 20 years. As for someone, it may break unexpectedly. But in fact, most patients are much more likely to not undergo reoperation even after 30 to 40 years. But these days, everyone's lifespan is a lot longer, so I don't usually tell my patients that they'll be able to use it for the rest of their life, as they might live till 120. However, when aiming for an average age of 90 to 100 years, because that's the average, I think it's safe to say that if it's an artificial joint that's done around 70, it will last a lifetime.
Thank you so much, Doctor Seo. Very, very nice interview. Thank you.
Thank you.
Today we learned many things about the treatment, and the doctor explained in details everything related to artificial joint surgery, such as its indications, how the operation is done, and possible complications of it. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.